Thank you.
I just made a new best friend. That was wonderful. It is so nice. And I want to commend Stanford for putting on this presentation. I cannot tell you, I've been in the field of healthcare now for probably better than 25 years. I'm not ready for geriatrics either, just like any of the rest of you in the audience, but I have been around and I've worked with older adults, and now I am one. So it is really wonderful. We have tried for years to get hospitals to look at what happens when people come into acute care environments. They're wonderful from medication standpoints and from the surgery and from fixing whatever is wrong with you, but they can be very difficult for older adults to navigate, especially with the number of people that we have with dementia today. So we've got a lot of information, most of which I can't share with you tonight, but I'm going to try to share as much as I can. I also have visual impairment. These are all the age-related changes that most of us are aware of at this point. Arthritis is the #1 chronic problem for older adults, and yet almost never do I see any environment for older adults that really addresses this issue when there are things that we can do. Hypertension, hearing impairment, 2/3 of people at age 65 have got some hearing impairment. I happen to be one of them. Vision impairment is rampant. Mobility impairment, vision impairment, mobility impairment are inextricably tied together. A lot of the falls that we have are because people can't see that well. Depression, diabetes, and osteoporosis, all of these are things that we need to do. But there are things that we can do that make these environments better. Enhance lighting, encourage mobility. We want to keep people up and walking all the time, and we need to develop environments that really inspire that. We know that very often, now there are times when you need to be in bed, but very often people get in bed and they don't want to get out, and we need to keep them up and moving around. There are things that we can do. Obviously, enhancing lighting helps with that. Eliminate unnecessary noise. I was thrilled to death to hear that you all had a program now to both enhance the lighting and address the noise issues in hospitals. We can use color to affect balance and that sort of thing. I'm going to show you some slides on that. Improve air quality, incorporate nature, and encourage family support and involvement, particularly while you're in the hospital, and especially for people who have dementia. This is not a program on dementia, but it's a lot more rampant than most people realize, and these are environments in acute care situations that can trigger some difficult behavior management problems. Our eyes change as we age. They go from seeing everything pretty clearly to not seeing things quite as clearly. Now, we're not going to talk about macular degeneration, cataracts, and glaucoma and that sort of thing, but it all goes along with getting a little older. And particularly with lighting, there is an immense amount that we can do to try to ameliorate the situation and make it easier for people who are faced with dealing with some of these issues. Interestingly, cataracts is huge in older adults. It's a very quick, easy operation, usually pretty successful, but many people just accept it instead of going in and having anything done about it, and it makes all the difference in the world. So I encourage you, if you know somebody who has cataracts, you may want to try to give them a little encouragement to have it fixed. Some of the implications of age-related vision loss: increase in falls, and this is huge. It limits mobility in unfamiliar areas and also limits independence. All of these are directly related to hospital and acute care environments. They're unfamiliar environments to start out with, and just trying to get out of bed and go to the bathroom can be something that can very easily trigger a fall. Some of the risk factors that we face every day are age, can't do a lot about that, vision changes, weakness and strength loss, balance, A fear of falling. Once somebody has fallen, they are terrified of falling again. Cognitive loss. Incontinence is now on the list of things that can trigger falls, and I'll tell you about a personal experience with that in a hospital. Environmental hazards and medications also are things that are huge risk factors for falls. We can, however, modify the environment. We can improve lighting, and this is not something for the sort of uninformed, and it's something that we can do an immense amount to improve lighting environments, but it's all in the way that it's done. We use a lot of indirect lighting now, and it's controlling glare, which is a huge factor for older adults. It's not only painful for people, but it also is a big factor in falls. We can provide strong contrast, color contrast in places that make a difference, and I'll show you one or two in a minute, and handrails for support. These are some of the guidelines that have been developed by the Illuminating Engineering Society of North America for care environments, not strictly for hospitals, but we would do well to pay attention to some of these guidelines. They all make sense when you look at them, but you need somebody who is skilled with changing the lighting in order to do that, but it makes a lot of difference. Sleep disorders are rampant in older people. Doesn't matter whether you're at home, whether you're in assisted living, whether you're in acute care environment, even more so in a hospital, because in most cases you have disruption, you have noise going on, and the lighting plays a factor in that too. 72% of nursing home residents have poor sleeping, and this is particularly in people with Alzheimer's. Sedatives and hypnotic medications are the common thing that are used to treat this, and these medications are strongly linked with falls again. So we need to do better with daylighting, with getting people outside to get sufficient light and reset a lot of our circadian rhythms and light levels. We know, and we have the research to prove, that we can improve sleeping without having to use medications. That doesn't necessarily apply to every person, but it's well worth getting out for about 20 minutes in the morning. Go out for a walk. It does not have to be in the middle of the day, but it's proven that it does a lot of good. Some of the environmental supports that we can use, this is a handrail that was developed for people who have arthritis. They can use the forward part of their arm to be able to guide along this handrail and don't have to clutch at all. Now, we have to meet ADA requirements, which either means that we need 2 handrails or that we developed one that does both, which is doable. But ADA does not work for older adults. And this is not anti-ADA. It is fabulous, and it was landmark for the people that it was developed for. It works, and we should do even more to improve it. But in most cases, it doesn't work well for older adults, and we really need to look at some of these issues. Handrails in bathroom is a great example that the reach limits of an older adult and the strength that they have doesn't allow for use of ADA handrails. So again, this is not a commercial for let's do away with it. It's fabulous, but we need to do better for people who really need the support. Also, when I mentioned before that we could use contrast and color, and we needed to have clear guidelines. If you notice, there is a clear differentiation on the horizontal plane on the floor and the vertical plane on the walls. You can see exactly where that is. And that can make a lot of difference to people who don't see well and to people who can use those guidelines to be able to tell where they are. Also, this, you can't really see it in this slide, but one of the things that we've done with floor covering, this is actually a carpet that is a tone-on-tone monochromatic pattern. It doesn't show up well in this slide, but it's a place where we can use color and pattern on the floor that doesn't affect people who have good eyesight. They can see the pattern.